the invitation will be to the RT Knowledge Network on Microsoft Teams platform. So we will be sharing this link at the end of the webinar, as well as a link to what Microsoft Teams is and a little introduction to how to use it. Thank you. Over.
Thank you so much, Katrina, for taking us through the Knowledge Network, Rapid Response Team Knowledge Network. Here, I just want to quickly remind everybody about a couple of house rules that we have proposed here in order to be able to work together smoothly during the webinar. So the first thing being for you all to have your mics muted, disable the camera. As I said earlier, and you have already started doing that, you can introduce yourselves in the chat box, but also use the chat box throughout the webinar to ask any questions or clarifications, make contributions, share experiences, etc. So, and again, the activities we will be having during the webinar will require from you, from all of us, to use an application that is called Slido. And this application, you can very easily access it scanning a QR code that we will present to you, or typing a link. But for that, you also need to use your smartphone. So the ideal situation for you to attend any of these webinars is to participate from a desktop or laptop, and in addition to have your smartphone available for participation to the webinar activities. So we are now going to test the use of this application Slido. So I'm going to pass the floor now to my colleague Silvio, who will explain us how to use it.
Hello everybody, my name is Silvio Mena. I work also in the training team based in Lyon at WHO. So I'm going to show my screen first. Hopefully you see my screen. Do you see? I think so, yeah.
Yes,
so
yes,
as Paula just said, you can scan the QR code, or you can type slido.com on your phone, I mean on the browser of your phone, such as Chrome, for instance, or Safari. And then the password is RRT2. And I will go to play now. So we have one question for you, which is, please provide 1 or 2 keywords that come to your mind regarding community engagement for outbreak response. We give you, I think, 2-3 minutes.
Thanks, Silvio. So this activity is just a quick brainstorming activity, and it's an icebreaker as well. So we are just testing for the time being.
It's going faster than last time.
Yes, I guess that many people are now used to Slido and are prepared. Okay, so 2 keywords that come to your mind regarding community engagement. You can add as many responses as you want, I guess.
Let's try if you can have 100 people. So far we have 56.
Okay.
And we see that risk communication is a good one. Trust, of course, collaboration, community mobilization. Empowerment.
Stigma, of course.
And stigma, yeah.
Yes. Okay, thank you. So how many people do we have, Silvio, now?
68.
Out of 153.
Yes.
Good, thank you. Many concepts related to community engagement that are mentioned here. You will see that during the webinar we will go through many of them in different ways. I see also that participants still join just at the time we talk. So we have many people who have just joined. So for them to know that we are now doing an icebreaker activity that's also used to test the application Slido that we will be using throughout the webinar for engaging you all into webinar activities. Okay, so it's either you can join this application scanning the QR code or typing in your browser slido.com, and then the passcode is RRT2, sorry. Great.
And if you cannot join us on Slido, you can type if you want on the chat box, but it's less visual.
Yes, definitely. So welcome to the ones that are just joining right now, from Sudan, from Egypt, from Myanmar, from Yemen, Trinidad and Tobago, South Africa.
So there are many good things. I think we should not focus only on the big words, but also on the small one. Yeah, respect, awareness, resistance. I saw something before. Okay, fine. Five more?
That's for the test. Okay, 5 more. Let's go up to the 100. And let us keep in mind that we will be having such type of activities throughout the webinar. So please remain with us, remain concentrated in what is going on here, because you will be requested to engage and involve yourselves into the activities.
Yes, we have it. 100.
Great. Thanks.
I stopped sharing my screen.
Thank you. So I'm okay. So thanks very much, Silvio, and thanks very much everybody for participating to this icebreaker activity, icebreaker and brainstorming activity. So the group who has prepared the content of the webinar today and who is going to deliver is composed of a series of colleagues from both from WHO and CDC, including Dr. Juliana Nuko from AFRO, Dr. Supriya Basbarwat from Zero, sorry for my pronunciation of the names, Mr. Tamar El Maghrabi from EMRO, Ms. Leah Dick from CDC, and Dr. Yolanda Bayugo from WHQ here in Lyon. So each of them will be introducing themselves as they take the floor. So I'm now quickly going to go through the webinar objectives and give the floor to the first presenter. So the objectives of this webinar is that at the end of the session, you are able to identify the key challenges, solutions, and some new insights for the effective community engagement, that you familiarize with different approaches and tools for effective community engagement, and that you are able to determine roles and responsibilities for rapid response team members in engaging with communities in the context of COVID-19. This is to set the scene of what will be coming just now. So now I'm giving the floor to Dr. Yolanda Bayugo. Yolanda, it's your turn.
Thank you very much. Good afternoon, good morning, good evening to all. So I was asked to do a brief introduction on the community engagement. So what I thought, instead of asking you what do you think about community engagement, I thought of the context wherein you are going to explain community engagement to a new new team member of the RRT. So I have prepared 3 questions, which Silvio will play a bit later on Slido. So in this exercise, you will be asked how you will explain community engagement to a new member of your team. And your responses before the session ends, this webinar ends, I will compile them and show it to you later on. And this will be part of the documentation for this webinar. So without further ado, we have 5 minutes to complete this. This is just 3 questions, and for veteran RRT members doing community engagement, this will be easy for you. Over. Silvio?
Okay. I will share my screen first and go to the next step. So again, for those...
We don't see your screen, Silvio.
You don't see my screen?
I don't see.
That's annoying. Okay, sorry.
Yeah.
I have 3 screens here and then, okay.
Good. We are with you now.
Okay, so normally, for those who are already connected, you see now a new page. And for the others, you can, again, you can scan the QR code or type on your phone, slido.com, and the password is RRT2.
Yes, so you will see the questions popping up in your smartphone. So you have 3 questions here. The first one being, please explain what community engagement is to a junior colleague you are mentoring. So it's an open answer. You write down the way you would explain community engagement to one of your colleagues you are mentoring. Second one is explain to your junior colleague what is necessary for, why it is necessary for rapid response teams to work with the community. And the third one is provide some pointers to your colleague on what he or she needs to know in working with the communities. And once you have responded to the 3 questions, you can now send your responses. So we have a few, we will take 5 minutes for this activity. So in 5 minutes time, we will then stop. If you are not able to log in with the QR code or with the address, slido.com, in this case, you may write your answers in the chat box. We can have a look at them as well.
So we already have 2 person or 4 person reply to the 3 questions.
You can also provide a sentence to provide explanation. So it's open-ended, and I will compile this later. So no problem if you have more text, because this is how you will explain community engagement to your new team member. Yeah, involvement of local people. Yeah, it's good. Appropriation, adaptation of the response. You can also provide examples. involving, respecting community, bringing community together. This is very good. Okay.
I can show the second question if you want.
Will that?
But it's okay because we will wait for 5 minutes and
Okay.
for this to finish, so we can move from one question to the next. It's also okay.
Okay.
Silvio, just a question. It doesn't stop people from voting if you show the next
No, not
question.
normally, no.
Okay.
I mean, for the three question, and then when I reach the end, then it can stop the session.
And I think it's really a good idea to do this kind of introduction because it would be unfortunate if we don't get your thoughts on this, because we know very well that those who are in this webinar are seasoned RRTs and who has done a lot of work in the communities already. So thank you very much for this contribution.
I think, Yolanda, you will have a lot of work.
I'm in. I'm okay with that.
Okay, very good.
I'm very excited to summarize this, honestly.
This is very good, yeah.
We still have 2 minutes to complete the activity, and we will move to the next step.
Maybe I can show the second one now.
Right.
I mean, on my screen, it will have no effect. Because we receive also all these. So the second, is, yes, please.
Sorry, explain to your junior colleague why it is necessary for rapid response teams to work with the community.
Okay, let's go to from the bottom.
So we have a lot of good suggestions here to respond to that question. Rapid response team can't work alone. This will help the team to respond effectively and efficiently to any outbreak in the country. We need to have a well-coordinated approach that includes the community. Social, cultural, and religious beliefs of the community are taken into consideration. Hence, we can expect receptivity and two-way communication, I think, or something like that.
So it's very good. We have 86 answers so far. Knowing that it's quite long sometimes. Okay. Next question, just to see it. I mean, okay, let's go very quickly first. Decrease mortality and morbidity rate. To get support from community to make RRT able to serve the community. Okay, community cannot measure the risk of any health problem they faced. Okay, next. So the last question was, provide some pointers to the colleague on what she needs to know in working with the communities. Okay. Sensitivity to culture, multi-sectoral approach, respect people, understand the culture, build trust. A good one. Trust is frequently on our screen.
Okay.
Trust, enthusiasm, live, okay, and work as a member of community. PPE, good collaboration.
Good.
Okay, I think.
Let's move now to the next step. If you want still to contribute to that questionnaire, you can type your questions on your answers, sorry, on the chat box. And I see some people have started doing so. So thank you for those who are responding to the chat box.
I'm going to shut the session.
Thank you very much. And I really appreciate your contribution. This will be very important for the documentation of this webinar and for our continued learning. Thank you.
Thank you. 10 seconds and I stop here.
Thanks so much to all of you. We will review what you have answered to the various questions and wrap up at the end of the webinar. Yolanda will prepare that for the group later today. So now we are going to have a country example that illustrates many aspects of what community engagement and risk communications are. And for that, I will give the floor to Dr. Supriya, who will be presenting us the country example and the questions that go with that. Dr. Supriya, is to you now.
Thank you very much, Paula, and good afternoon, good morning, good evening, wherever you are. It's a pleasure to be here today. And I'm delighted that so many people I see are also from CRO. I am Supriya Bezbarua, as Paula said. I lead on risk communication and community engagement for CRO for the Health Emergencies program. And I've been in risk communication and working with WHO now for more than 10 years. And I really feel very passionately about it. So therefore, it was a delight to see the responses you've given, because they're so relevant. And the country example we have today is actually happened in a country, but I think many of you on the ground will recognize it and will have experienced some sort of it. And it also reflects many of the concepts that you mentioned previously, like empowerment, respecting culture, and key to it all, trust. So over to our country example, it's there was a district town with increasing number of COVID cases. So can you hear me?
Yes, please, everyone,
yeah, okay.
Can you please keep your mics muted during the presentation? Thanks to all.
Thank you. So both RCC experts and healthcare workers visited homes as part of the program to let people know about preventive measures like wearing masks, hand washings, and also to explain the symptoms of COVID-19 and tell them that, you know, if they have those symptoms, they need to go to medical authorities and report. But to their surprise, can you click to the next one? I think, Paula. Yeah. To their surprise, many people, they found that many people didn't believe that COVID-19 existed. What they heard from people was that, oh, it's just a normal flu, and the whole thing is a hoax, and you know, it's because hospitals are making money. Apparently, the government gives extra money to hospitals for COVID cases, so it's just a way of making money at the people's cost. So that was very concerning for them, and even found some people hostile. So what could they do? So they continued to meet, listen, and engage with people and try and explain to them that it's not a hoax, but they needed to convince the people as well. So they worked with different community leaders to understand the reasons for why people had these perceptions. And then while talking, they realized that because of COVID-19, many people were not getting treatment for other regular problems as well. And with that, and with not knowing there's so many COVID people, they thought it was a hoax. They then, the health workers and RCCA experts then thought, okay, let's show them what COVID is about. And they requested family members of those who'd recovered from the disease to speak to the community so that they can hear firsthand what this disease is about, that it's not a hoax, and convince them that it's really important to report the symptoms and take protective measures. Along with requesting family members, they also tried to highlight how the health system helps the community in many ways, even beyond COVID. So that was in a way to reassure their fears that was concerning them and build trust in the health system. At the same time, they also engaged influential people in the community, those who were leaders, those who were heard, those who were respected. And that included faith leaders, prominent members of the society, you know, maybe some big business people, big school teachers, people who were respected in the community. And they continued with that. And eventually people in the neighborhood, more and more people began to believe them and slowly took up these measures and took them seriously. I think this might ring a bell with many of you here. So let's go on then to the questions. So we have a few questions related to this example. I'd love to hear your views.
So again, for responding to those questions, you can use your smartphone and scan the QR code that you see here on the screen, or type slido.com and use the password RRT2 to join the quiz. So yes, Silvio is now launching the quiz. We should be, yes. Okay.
We are.
Here we are. So we need to scan. Some people, sometimes they just have to scan once. Sometimes you have to scan more than once. And this is how it is.
Right.
So the first question being, okay, what do you think?
The first question.
Go ahead, Sophia.
No, go ahead.
No.
Okay.
Just for everybody to hear at the same time, what do you think are the best ways to convince those concerned people that COVID-19 is not a hoax? So you can choose the answers that you feel are correct.
So I'd like to add here that, you know, there is no black and white, right or wrong question. As this is an, you know, it's very much contextual and depends on the situation on the ground. And, you know, and the answer or the right way or the effective way could be multiple ways of doing things. I just wanted to add that too. Right, thank you. So most people seem to think that listening and asking questions about why they feel is the case needs to be done. And absolutely, that's the only way you really get to understand why people are responding the way they do. Have a mass media campaign saying that COVID-19 is real and dangerous. That's absolutely right. Mass what mass media campaign does is it creates awareness. But along with the mass media campaign, you also need to keep the dialogue going to convince people. Organize a public meeting between doctors and residents. That's to have a dialogue, and that might also build trust. Tell them that they may not know about medical matters. You are an expert and you know that COVID-19 is real, so they should believe you. And that's 24% people feel that way. That is on one hand, the fact that you are an expert, people tend to trust experts, but at the same time, people are also experts on their lives. So that needs to be, it's how you say it that will make all the difference. It needs to be a dialogue between the people, and they should not feel that they are not being listened to. So it would be needs to be done, in a way that engages the people affected. Shall we go on to the next question?
Yes.
If that's done. In an emergency, time is a premium. How important do you think listening to the people's views is in this context? And many of you work on the ground, you're in a rush. When you're in a rush, is there time to listen to people? How important is it? Because the majority feel that it's very important.
I can go to the last one if you want.
Yeah. So again, there's no
Oops.
right or wrong. So it's interesting.
Oops.
No, that's
I made a
that's not the
mistake.
no.
1, 2. That's, I'm lost now.
Yeah.
Yeah, but I
This
lost
is
the answers, I think.
the next one from this.
Oh yeah, okay, good.
Yeah.
Next one.
Next one. Yeah. Which do you think were good ways to build back the community's trust in the medical care system? Engage faith leaders and other community leaders and get them to convince the rest of the people. A lot of people have more informal interactions as well. A lot of people think that, and you're right, that's the way. If you engage faith leaders and other people who are trusted, human beings are also, in a sense, herd animals. We follow leaders, so that's a good way to convince people. They listen to people who lead them, have more informal interactions between healthcare professionals and communities. So that builds better understanding, more trust, and then they work together better. Get people who were affected by COVID-19 and helped by the hospital to speak directly to the people. One of the issues was that, the corrosion of trust with the health system and the hospitals, because they thought the hospitals were it was just a scam. So when they speak to people who were affected by COVID-19 and were in the hospital, that also gives them an idea that it wasn't a hoax. So all of them are effective in building back the community's trust. Thank you. Great responses. Thank you very much.
Okay, so yes, great. Thank you, Dr. Supriya.
Thank you.
Thanks, Silvio, and thanks for the participants who did participate to that activity. Actually, as Dr. Supriya said, the responses to those questions have also to be put into the context. And yes, some have to be seen with some sort of flexibility, and what works in a national context will probably not work exactly the same way in another national context. So this is your work to you all to adapt to whatever messages we are conveying to you to your own context. Now we are going to move to another step in our webinar, which is going through a few principles, concepts, tools about risk communication and community engagement. And to cover that part, I will call can you hear me?
Yes, we can.
I'm sorry, I didn't. I lost the screen view. Okay. Can you see the screen? Yeah.
Nope.
Ah, okay. Sorry. So I was not in the right place. Here it is.
I think yes. Very good.
Okay. Thank you. I'm sorry for the inconvenience. So now we are going to enter into this part that is more reviewing a few concepts and tools and approaches about risk communication and community engagement. So I'll give the floor now to Ms. Leah Dick, who is a colleague from the US CDC, to tell us more about these tools and roles and approaches. Leah, it's your turn now. Over to you.
Good morning, good afternoon, good evening. Thank you all so much for joining, and thank you for letting me join. Enjoying the session so far and learning a lot. So as you all know, we've seen on the previous slides here, community engagement or social mobilization, it can have a couple different names. It's an important part of any RRT. And as we've seen in the questions before, there's an important relationship not only within the RRT, but the most important relationship isn't shown in this graphic here, and that is the relationship between the RRT and the community. I saw a great phrase earlier on in our questions that was bilateral communication. And as a community engagement responder, really any responder on the team, your job is to build that bridge between the team and the community. And that bridge goes both ways. We heard a lot of listening. Listening was a big thing that we heard in our first case study and also in the questions that you all answered. So very much appreciate that. And maybe my slides will be a little bit repetitive, but that's okay today. So that relationship is going to be interactive. It requires listening and it requires dialogue that goes both ways. We had in the first example, an answer of, coming in as a professional, and we have years of experience, we have education, we have all these valuable things that we so badly want to give to the community. But if I come into a community and immediately start throwing that at people, they don't know me, they don't know who I am. So having community engagement is incredibly important for making sure that all the hard work that the RRT is doing actually translates to behavior change in the communities that we're working with. And the ultimate goal of that relationship that we're building is to empower the community. If anything, we want to work ourselves out of a job, if that makes sense. So something important to note is that, the community that we're responding to, it existed before we got there. It exists while we're there. There are going to be competing issues, whether that's public health issues, it could be civil unrest. We're seeing sometimes in countries now that COVID-19 is not even, no matter what the case count is, it may not be the primary concern of the community that we're working with. So like we said, context is going to be incredibly important here. And that means that our relationship with the community could change just over the course of the response while we're there or over the response long term. Next slide, please. So ideally in a response, we would have a fully staffed RRT, everyone has their specializations. That's not always the case. Obviously in COVID-19, I think, we've seen a lot of being stretched thin. And sometimes that requires people to take on multiple roles and responsibilities. And one way to do that is, there is overlap between community engagement and social mobilization, as well as risk communication. But that's not the only place that risk communication and community engagement should obviously show up in our work. In a response like COVID-19, where time is incredibly urgent, for instance, if lab results aren't getting out to communities for 2 weeks, then that lab work, that just goes out the door. So we need to make sure that we're engaging with the communities in all aspects of our work. Next slide, please. So some operational objectives. I'm going to go through what community engagement can look like sort of from a very grounded operational standpoint, because a lot of times simply talking about starting a dialogue or listening, it can feel a little abstract or unsure. So like we said, it means coordinating, and I saw that word so many times earlier, and I very much appreciated that. It means coordinated not only with others on the team, but also with the community itself. Identifying rumors and misconceptions, as we said, as well as resistance and reluctance in the community. And it means tailoring communication materials to the dynamics and needs of not only the unique public health event situation that we're in, COVID-19, but also to the community. Next slide, please. Okay, so these are just some examples of activities. And this is some ways to actually tangibly build relationships with communities. And if you'll notice here, a lot of these activities that we have listed, this isn't an exhaustive list in any way, but a lot involve listening. So we have monitoring public discourse for misconception and rumors. That's listening. Establishing methods for understanding concerns, attitudes, and beliefs. That's also listening. Identifying target audiences and gathering information about their knowledge and beliefs. That's also listening. And then collecting and answering all questions from the community, which that came up in an earlier slide as well. Next slide, please. So obviously in any response, time is a huge factor. We're seeing that in COVID-19 as well. And while our name says rapid response team and we need to respond rapidly, we do need to take the time and invest that in to get that buy-in from the community. But an easy way to do that, or well, I shouldn't say easy, a way that is easier comparatively to get that buy-in and trust, as we saw, is identifying people who are already established in the community. The community has its own strengths, its own leaders, its own representatives. And by forging that trust and relationship, it can get you some community trust and buy-in in a short amount of time. It's not going to be everyone, but at least it will get you plugged in earlier on. Networks like women's groups, religious groups, unions, youth associations, that can also help. And then by training those leaders and networks, especially in doing plain language messaging, that ensures that your message is getting to the community in a face, in a language, in a voice that is familiar to them, that they understand and that they can hear. Yes, next slide, please.
Yes, sorry, Leah, for the interruption. Yes. For the participants, if you have any questions that you want to ask related to what Leah is just presenting now, please feel free to write them down in the chat box. We will take a few minutes afterwards to address those questions. Thank you.
Thank you so much, Paula. And thank you, everyone. I do already see some questions popping in, so thank you all. We will have a slide at the end to work work with that. So again, like I said, community engagement can feel, some of the concepts we're talking about can feel very abstract, especially if there's a lot of like contextual and dynamic issues that we have to take into place. There's no one answer that's going to apply to every community that we work with, unfortunately. But the good news is that we do have some examples here of tangible deliverables for this role. So that could be a map of areas that you've targeted with campaigns. It can be the community leaders and the networks that you've not only identified, but hopefully started to work with. The messaging that you've tailored for different audiences. CAP surveys, so that's knowledge, attitude, and perception surveys, and that ensures that you're getting that community feedback and that listening in a documented, straightforward way, as well as communication surveillance reports from formal and informal channels. Now that could be country cables, could be situation reports, it could even be WhatsApp groups. It really depends on the communication methods that are most popular in country and that work in country, especially with vulnerable communities. Next slide, please. So this is just a sample checklist of actual tools that you may want to bring with you to the field. One thing that I do want to bring some focus to is, I believe, the third point up, which would be awareness of recent and or historical events impacting a community's willingness and ability to engage in preventative behaviors. This is something that's incredibly important. Like I said, the community has existed before you were there. They will exist after you leave. And having that awareness of those dynamics, whether you're researching it yourself or getting that information before you come to community, hopefully in a pre-deployment briefing, that's incredibly important. Some other things that may help would be having an ID badge, having an ID vest. That's a way to sort of establish the organization that you're working with in a public way without coming in and saying, hey, I'm the expert, you need to listen to me right now. As well as one of my colleagues suggested adding this, and I thought it was a fantastic idea. Obviously, we all have our electronic devices and phones on us, having those materials not only printed and with us, but on our phones and ready to go. Next slide, please. All right, and now the question and answer portion.
So participants, Leah and other facilitators, we can take now a maximum of 10 minutes to address questions. So I'll let you, Leah, review what we have in the chat box and take some of these questions. And other facilitators are also welcome to provide their inputs and views. Thank you.
Okay, so the first question that I see here, apologies, I'm going to start a timer on my phone so I don't go over time. On the RRTs, don't we need a data or M&E person, or will the roles be diverted to an EPI? Now, as somebody who is very much, I work in risk communication, I work in community engagement. So please, one of my other co-facilitators, feel free to jump in here and correct me. I would assume that data and M&E would be integrated not only into every, should be integrated into every role somehow, if that makes sense. That monitoring and evaluation should be something that we are thinking of while we're responding, whether that's lab, whether it's communication, whether it's EPI. Again, please, someone feel free to jump in if they don't feel like that is correct. And yes, it looks like Yolanda, thank you for answering questions while this was going on. She said, yes, we do need it. And sometimes it is part of the role of the epidemiologist. Yolanda also said, yes, in a limited response, one RRT member assumes several roles. Okay, and I haven't gotten any other questions so far, so would love to hear any others. I know we went over that information quickly, and I will say that that the text in the slides is from a document that you can you can reference the slides afterwards, but there is a document I believe you all have access to that goes over different roles in a rapid response team in a similar fashion and in a little more detail. And the link is below on the slides that I just presented. Is it legal/ethical to multiple numbers of cases? I apologize. I don't believe I understand the question. Are any of my co-facilitators online? Would you?
We can also ask the person who raised the question to clarify exactly what you mean, because it's true. I myself cannot really get the exact point. And
Mohammed, yes, I agree. Mohammed, would you mind unmuting and letting us know what question, giving us some more information on your question, please? And if you're not able to unmute, that's okay as well. All right, we will come back to that. I apologize, Mohammed. Maria says, you will also need to ensure getting the information out in different languages. Yes, especially when there is a multi-language community, that's incredibly important. That should be an aspect of the CAP survey that you're doing, and not only capturing the popular languages, but especially the languages that are specialized to vulnerable and minoritized communities as well. So thank you, Maria. That's incredibly important. Dr. Ankush says, how religious leaders can be involved in COVID cases where all religious places are closed. Okay. Yes, that is a great question. I would say radio. It really depends on what channel is going to be best for reaching your community. So in a community where perhaps internet or social media is not something that's accessible to most people, or the community that you're trying to reach, and let's say they rely on radio, having a religious leader come on a radio show and speak could be a good way to reach your community. So it really depends, again, on the context and the dynamics. Mohammed specified to get the community response to messages. Mohammed, are you asking if it's legal or ethical to multiply numbers of cases to get the community response to messages? I apologize. Yes. Okay. Is it multiply number of cases? So more than anything, we want to be honest and frank with the community that we're working with, and perhaps numbers may not be the best way to explain the impact and severity of COVID-19 or of any other public health event. I've seen that before in communities where, oh, it's only this many cases. Why should I worry? It's really not that much. So having someone like a survivor speak to the community, especially in COVID-19, where there are long-lasting impacts of the disease that we're still learning about. Having a survivor come out and speak about their experience, having that emotional appeal can sometimes be a good way to reach a community without having to rely on case numbers, if that makes sense. I hope that answers your question. Apologies, I'm catching up on the chat here. Thank you all so much. Yes, and Yolanda brought up the point of terminologies and talking medical jargon may not be helpful. That's very true. And that's why we very much encourage plain language messaging, which can sometimes be a challenge with COVID-19. But we have definitely seen it done, as well as keeping messaging consistent across the team, even if you are tailoring messages, making sure that the base facts stay consistent. Yes, and Supriya spoke of religious leaders using social media and other various means. Thank you. Also making videos of community leaders, speaking messages and forwarding that to followers on WhatsApp. It's a great use of WhatsApp. How are the needs handled and how well in current practice and analysis? How can we do better? I think that's a fantastic question. I think that's also where monitoring and evaluation comes in. And I think that it really depends on the community we're working with. I apologize, I feel a bit like a broken record with that. But I think that underscores the importance of monitoring and evaluation, which can be a challenge in especially communication work. But I think it is incredibly important to consider when you are planning, executing, and then wrapping up your activities in country.
So Leah, we can take an additional question, then we will move to the next step of the webinar.
Okay. Apologies. The flow of information from various sources and plenty of them can pose a problem for the RRT in the field. How would we deal with it? Yes, I agree. I believe we've all seen that. Would any of my co-facilitators on the call like to weigh in on the question?
Leah, I think, and please feel free to share your thoughts as well. I think one way would be to find out the influential people in that community and engage them first and get them to then talk about what the get them to talk about what the facts are and help them sift the facts from the rumors, because you will not be able to address everybody at once, but people will listen to those that they trust. That's just one way. And in addition, also have discussions with people along with social media and other campaigns. Depends, of course, on the social media reach of that community.
Thank you so much.
Great.
And I believe we're coming to the end of the question and answer portion. I apologize for not being able to get to everyone's messages, but we're still having some great conversation in the chat. So I invite you to, if you do have more questions, to please write them in there, as well as continue your input, because I would love to also hear from folks that are on the call about what's worked for them, their experiences in country as well. I'm going to hand this back over to Paula. Thank you so much.
Thank you so much, Leah, for presenting and responding to the question. Thanks for the colleagues who engage in the discussion. It's a great discussion so far, and you may realize that during the next activities, for example, now we are going to have a case study. Some of the questions you have raised may find some sort of response. So what we are going to do now is to go through the case scenario. And I'll invite now to present the case scenario and the questions that go with that case scenario. I'll invite Dr. Lyon Office, who is with us.
Hello, everyone. Good morning. Thank you, Paula. Unfortunately, my light is not well oriented, so you can't see my face. I'm sorry for that. So I'm Dr. Juliana Noko. I'm risk communication and focal point in social sciences, focal point of the regional office, WHO regional office for Africa. I'm based in Dakar, in Senegal. Good morning, good afternoon, wherever you are. So I prepare this example based on the risk communication experts who are currently deployed responding the COVID-19 pandemic in the field, because many countries have opened schools, others are planning to open school. All of them are worried because of the uncertainty. They don't know what will happen if schools are opened. Others don't know what will happen if students and teachers who are currently at school, what will be their situation regarding COVID. So this issue is a very hot issue now. This is why I chose this example. So the scenario are in two steps. So this is the first step. A 14 years old male student has been tested positive to COVID-19. Sorry, has been tested positive to COVID-19 on the 5th of July. During the 5 past days, he has been presenting symptoms such like light cough, sore throat, and light fatigue. During this period, he has been going to school by the bus transportation. There are about 1,200 students and 300 teachers in his school. His mother took him to the Prince Hospital where he was tested positive. Can we continue, please? So, you have the questions in the Slido. Please proceed with your smartphone. Maybe Silvio, you can help us on that, please?
Yes, sharing my screen first.
Yeah.
We can see that we have already 33 people registered, 42. I click on the next. And so we see now the first question. Maybe I let you read the first question.
Yes.
Do you see it? It's on the top, just here.
Yes, this is the first question. What are the 3 major strategies that you have to put in place at this early stage? The early stage is the risk communication early stage. You are a risk communicator expert. What are the 3 major strategies that you have to put in place at this stage? Over to you.
So we give you 1 or 2 minutes. We'll see until we reach at least 80 people, or maybe 100 if you can. $71. Okay. Can see. We'll go to the next one very soon. The second question, we have 2 questions for the step 1.
Okay.
So 4 more. Okay, maybe I can move on. 2 more. We'll see. Okay. And again, for those who cannot join us on Slido, you can answer if you want on the chat box. Okay, let's go to the next one. So do you want to comment this result already, or I can show the right and wrong answer otherwise?
Yes, I would like to comment. Yes, many of you have give the correct answers, but we have 29% of people who have said that we have to launch a risk communication campaign on COVID-19 for the entire city. I think that this should be should not be the right way, because the situation is happening in the school, and people who are really in need at this early stage of the situation are people, the school management team, the school transportation enterprise manager, and you have to develop the IAC material for COVID-19 prevention and response in schools, because we are in the early stage. Before informing the entire city, we need first to focus on the main group who have to receive the information, and where we should put the first community engagement activities. Thank you, Silvio. Over to you.
Okay, let's go to the next one then. Right. Oops. There's a small issue. So we have the dashboard, the leaderboard. So Eugene Chering is the first so far. Let's go to the next question, and we'll see the leaderboard afterwards. Well done, anyway.
Yes, now we have the question 2. Do you think that the school and the transportation company are the only concerned to implement community engagement? So, do you think that only the school and the transportation company are the only concerned to implement community engagement? Over to you, Sylvia.
Okay, I will give some more time before showing the screen, because when I click on the next screen, it stopped the quiz. So let's say we still have 30 seconds, because I can see that people are replying faster than before. Mm-hmm. 6 more. Very quickly, 10 seconds. 5, 4, 3, 2, ignition. Okay, I give you the floor.
Yeah, thank you, Silvio. Thank you, everyone. Yes, of course, you know that you understood that not only the schools and the transportation company are the only concerned to implement community engagement. We have also we can also involve the parent association of students, because they need to know they are managing the overall activities in schools. So they are also involved. They have to be involved in this community engagement activity. Maybe many other persons, but at this stage we think that the association of parents of students have to be involved in this community engagement activities. Over to you, Silvio. Thank you.
Okay, let's
Thank
see.
you, everyone. Yeah.
Yeah, thank you. Let's see the leaderboard for these two first questions. So again, we have Yugen Chering, probably from Bhutan, at as the first one. Then we are Trang Do, Deki Yangsom, and sorry for my pronunciation, Sonam Wangdi, Miranda Rashalina. Well done, and well done for the others. Sorry, they were faster. That's the reason why also you see the time. So let's go to the next question. I think it's an open-ended question.
Oh.
Next.
Okay.
Here, now we have the question 3. This is an open-ended question. So you will have to use all the learnings that you heard from my colleagues before, mainly from Yolanda, from Leah, and from Supriya. So the question is, which communication tools should be used to inform students and their teachers about the coronavirus and the COVID-19 disease? So I would like you to know that we separate coronavirus and the COVID-19 because COVID-19 is the disease provoked by the coronavirus. Oh, great. Wow.
Very fast.
245. Wow. I think that all the experts, now we have all the people, risk communication experts, they are giving a lot of materials, a lot of information that should be used, a lot of tools, mass communication, posters, local media, mass media, meetings. Leaflet, video calls, WhatsApp group.
Okay.
Great, excellent. So
Excellent, fantastic. Okay, over to you.
Thank you, thank you. Silvio, can we stay in Slido
Yes.
for the second step?
Of course.
Okay.
Let's go. So that's the second part. I'll let you read the second part of the scenario.
Okay, congratulations for the first part and all your good answers and your tools. I feel that you are expert in risk communication, and this is really fantastic. So for the step, this is the step 2. I will read the step for you. The 14-year-old boy lives with his parents, grandparents, and 3 brothers. Case investigation recorded neither history of recent sickness nor any travel from any members of his family and from his school. But one of his friends who lives in the neighborhood was sick with flu-like symptoms 10 days ago. Case investigation is still ongoing to identify the exposure history. The director of the school has not yet informed the parents about the situation. So this is the 4th question. What approaches are you going to recommend to the director of the school in order to inform parents? So I will read again the question. What approaches are you going to recommend to the director of the school in order to inform parents? Over to you, Silvio. Thank you.
Okay. So we'll wait a little bit more because I can see that there are still people writing down their answers. So currently we have 66, and I know that we are about to 100 users. So on Slido. Okay. Five more, four.
Yes, let me please excuse me to have a reminder. Silvio, we are expecting a Slido report for Yolanda.
I sent the report long time ago.
Okay.
And you are copied.
Okay. Thank you. So we can move to the responses, probably.
Yes.
Okay, so Dr. Julienne, would you like to review the answers? But you are muted, huh? We are not hearing you.
Sorry, yes, I was muted. So, wow, I'm just, let me remove, okay. Yes, you have two correct answers, and 93% of you, has given this answer is fantastic. You have also given another correct answer, the third one, organization of sensitization session on the prevention of COVID-19. But you have also given another answer, the second one, meeting with the transportation company owner to decide on preventive measure. I think what we,
sorry,
please, can you come back to the saying thank you? So I think that the question was, how are they going to inform parents? This is only for parents. So if they meet with the transportation company owners, I don't know if, maybe if the transportation owner is also a parent, he will be met with the parents, because this is a meeting organized by the director of school to talk to the parents. So they have to meet the representative of the parent school association. This is fantastic. They have also to organize a sensitization session on the prevention of COVID in school with using IEC material. I think the second one is not really correct as an answer. Okay, the first one and the third one are in this case the correct answer. Thank you very much, and congratulations to those who have given the answer, and to those who are going to change also their answers. Thank you. Silvio, over to you.
Okay, let's go to the fifth question then. Hope we still have time. There are some changes. C2 Hong is the first.
You have another champion now.
Yes. Next. So this is the fifth question. Yes, please go ahead.
Okay, can I come in? Yes. So the fifth and last question is, which initial key messages should the director share during these two sensitization meetings? If you remember, in the question number 4, you said that the director has to organize a sensitization session using IEC material. So,
yes.
Which initial key messages? Sorry, can you? Thank you very much. So I said before that in the fourth question, you answered that the director has to use to organize a sensitization session using IEC material. Now, the fifth question is, which initial key messages should the director share during these 2 sensitization meetings? Over to you, Silvio. Thank you.
Maybe I went too fast now. And look, okay, sorry. Hope it still works. I'm just checking. And, okay. Unfortunately, you cannot. If I show the 8 possible answers, then it stops the process. So we'll wait a little bit more. We still have,
okay,
let's
it's
say,
fine.
20 seconds.
Okay, it's fine.
Okay. 2 more. You still have 5 seconds to answer. Okay, good. Next.
Okay, thank you very much. So, okay, thank you very much for your answer. Okay, let me just review. So,
Oops.
let me move this. My screen is not clear. I have some, now it's fine. It's fine. So, yeah, I really like the way the 95% of the question, what can you do to protect yourselves and kids and prevent the spread? This is really fantastic. We have also, can you, thank you very much. And what is the coronavirus? I don't know if you think is a good message, but at this stage, just remember that since January 2020, we have been communicating about what is coronavirus. I don't know if at this stage we need to focus again in this message as a key message, because you have been giving this message you started 6 months ago or 7 or 9 months ago for some countries. And this message, I think that people already know what is coronavirus, what is the COVID-19, what are the symptoms, because you have been doing this for at least 6 months since the beginning of this pandemic. But now, in this case, I think people would like to know what they can do to protect themselves and kids and prevent the spread and prevent the spread of the disease. They will like also to know what are the practical steps that parents should follow
Once a
Sorry.
child displays symptoms.
Exactly, yeah. When the child displays symptoms, thank you very much. They would like also to know the key message. One of the key message can be, what should you do if you or your child came in close contact with someone who has COVID-19? Remember that since the beginning, for more than 4 months, we had scientific information saying that maybe that we were not able to know if adolescent can transmit the disease. So as the investigation have been going through, we had the information that of course adolescent could transmit the disease. Now we have one adolescent who has been tested positive, and now people would like to know what can they do at the moment that adolescents are now able to transmit the disease and they are getting infected. So just try to focus on these 3 key messages what can you do to protect yourself? What are the practical steps that parents should follow once a child displays symptoms? What should you do if you or your child came in close contact with someone who has COVID-19? I think these are the three main key messages that the director should share with during his 2 sensitization meetings.
Thank you very much, Yolanda. Thank you very much, Julienne, and participants, and Silvio for this set of questions and answers here. I think there were also sorry, some participants responding in the chat box, and probably also it will be possible to address probably some of the questions before we close the webinar. And if not, you have to know that through the Rapid Response Team Knowledge Network, this discussion can continue. We will be posting the materials used during the webinar, and we will be together on these groups. We have French-speaking and English-speaking groups. The groups are dedicated to Rapid Response Team members, and we can continue elaborating on the areas that were not sufficiently elaborated here due to the lack of time. Thanks so much again to all, and we are going to go now to the next step, which are now the key messages of the webinar. And I'm going to invite Mr. Tamer to join us and talk about these key messages now. Mr. Tamer, is your turn now.
Thank you very much, Paula, and I appreciate being here. My name is Tamer al-Maghrabi. I work as an information officer for the Health Emergencies Program of the WHO East Mediterranean Regional Office. So let me try to quickly wrap up some of the key messages that you've been listening to today from the colleagues and the different presenters. So it's important to keep in mind that community engagement is a key component of a team's work to understand perceptions and behaviors. As a rapid response team, you guys have experts amongst you, lab technicians and lab experts and epidemiologists. But let's not forget that communities at the end of the day need to be listened to and need to be heard in order to communicate to them the messages that are most relevant to them. We forget sometimes as experts that when we talk about a disease, when we talk about an outbreak virus, especially a pandemic like this one, that different communities might not always tune in to what we're saying, maybe because it's too complex or maybe because they have other needs and other priorities. So it's important to listen into them, and community engagement experts are very important members of the team. Sometimes they are sociologists or anthropologists. Sometimes they're experts on risk communication and community engagement, but in all cases, they will be people that will help you listen in and understand some of the needs of this community. The second point is that it's also worth mentioning. I think we always talk about communities in the geographical sense, but we also have to remember that sometimes communities are based on professional affiliation. Teachers or drivers could be communities in themselves. And in the world that we're living in today, virtual communities are also very closely connected. For example, in the polio eradication program, which is a long-running program, as you all know, some of the diaspora communities, for example, from Pakistan and Afghanistan, live in the Arab Gulf region, in Saudi Arabia, and they work there. And so sometimes it's important to target those people outside the country, because we know that they message their communities back home and they're able to influence their decisions on, for example, in this case, whether the kids should be vaccinated. So a father working in the United Arab Emirates might call back the mother and tell her, please do vaccinate the child against polio. So we reach out to those parents in the diaspora community, and they will virtually connect back to their geographical communities and inform them. So sometimes it's important to identify these key persons and in order to bring in the community in a much more broader sense than just the geographical constraints. Communities also have leaders and influencers, as we've all heard, and we've talked about religious leaders and different community leaders. Sometimes they're informal influencers as well. We've seen now that many younger people are on social media platforms, and they have thousands and perhaps even hundreds of thousands of followers, and people listen to what they have to say. So it's important to reach out to them and to see what kind of messages we can get to the communities through such people. And I think this also tackles one question that I think Mohammed was raising on the chat group a little earlier regarding whether it was ethical and legal to engage communities while risking that cases might multiply. And I think he was referring here to the possibility of transmitting the virus through the members of the rapid response team as they move around communities. But here again, we have to keep in mind that engaging communities doesn't always have to be in the physical sense, the geographical sense, but we might also do that through the virtual sense by reaching them and reaching out to them virtually. We also have to keep in mind that the policies and laws of different countries vary. Every country is always advised to do their own risk assessment to identify whether their transmission is at the community level or at the cluster level or at the case level. And based on that risk assessment, you will be able to act accordingly as a rapid response team, whether your physical presence on the ground is possible, taking the necessary precautions, wearing the masks, keeping physical distance while interacting with and engaging with the community, or if perhaps transmission is too severe and the government and the authorities have decided to prevent such direct interaction, then there are still other ways of doing that through the virtual sphere and through other means like colleagues were suggesting, through radio, through television, and through other means in which the local community engage with one another. And finally, communities have their own needs and priorities, and it is important to take those into consideration and to tailor your health messages in response. I think at the beginning of this outbreak in early 2020, as health experts, we've had people's undivided attention about COVID, about the transmission. You'd watch news broadcasts for weeks upon end, and they would speak about nothing else but COVID. But right now, this is no longer the case, and people are frustrated with the lockdowns. They have economic concerns, but also even without COVID, some communities have always had problems. They have had problems perhaps with other diseases spreading in their communities, and they can't get the medication for that. They might have problems with power or infrastructure, water supply. And that's really what the concerns are. They might not have heard of many COVID cases or might not have heard of severe COVID cases and deaths perhaps, but they have heard of people not being able to use electricity, kids not able to go to school, or older people perhaps not having their medication. So it's important to keep these issues in mind. That's why we engage communities. That's why we listen to what they want to say, because each community might have their own special set of concerns. And in this case, we can weave in our messages within those concerns while taking those concerns into consideration and to be able to address them if possible, because as rapid response team members, you are also familiar with other diseases, you're also familiar with other contexts, and perhaps you can address these concerns at the same time and perhaps alleviate those challenges. And at the same time, that will help you achieve your goal dealing with the COVID-19 outbreak. So these are 4 key messages and perhaps some caveats to share with you after the presentations. I hope they're useful to you and happy to respond and happy to get your views on what other key messages you also find relevant. Thank you.
Many thanks, Tamer, for summarizing in a very brief time the key learning points for this session. So we are now reaching the end of our session. It has gone so quickly. I cannot believe it, but that's the truth. So we are now going to ask you all participants to evaluate the webinar. So again, for this evaluation, we will be using Slido, and in this case, you will need to scan the QR code again because it's like a new type of evaluation. Silvio will then show us his screen with the responses of everyone about the evaluation questions. So we have 5 simple questions, multiple choice. And these questions give you the opportunity to express what you feel about the webinar, how it went for you, how much it was useful to you. So here only participants are invited to evaluate. Okay, I see a person who is saying in the chat box that he or she couldn't use a Slido. Two people, I mean, probably some others. So feel free to respond to the questions in the chat box. So the first question is about, did this webinar respond to key questions and challenges you encountered? You can see that in the screen, in the field. And you can respond in the chat box if you are not able to log into Slido. Question 2 is, please indicate to what extent you agree with the following statement. This webinar enabled me to learn something new thanks to the examples and experiences shared by facilitators and participants. And the options are strongly agree, agree, disagree, strongly disagree. Then we have question 3, which is, please indicate to what extent you agree with the following statement. This webinar enabled me to learn, coordinate my learning on methods, principles, and tools for community engagement in the context of the COVID-19 pandemic. And then the fourth question is about methodologies and tools used during the webinar, if they were good and facilitated your active participation. And finally, we have an overall rating of the webinar with a 5-star scale. Okay. Thank you. We can leave. Silvio, the vote is not closed at this stage, right?
No, you can see that
Okay.
it's still moving. We have 70 people currently.
That's great. Thank you all for giving your feedback. We can wait until we have a more substantial number of people who were able to vote.
Maybe we can move on because I can see that we are stuck at 70%.
Yes, 70 participants.
Yep.
And no more move. Although we are 150 feet connected. We would be really grateful if you could provide us with your feedback. Could be more representative if we have more people. Of course, we have those who are voting in the chat box.
Anyway, it's a good score. So it's encouraging.
Okay.
4 stars, I think, is the best score. 5, it is too much. It's
Yes, so there is a new code, new passcode for this activity. The password is eval. So probably this was one of the things that stopped people from. Thank you. Just as some additional people continue doing the evaluation, I'm just going to remind that We will be sharing with you very shortly the presentation that was used for the webinar, the questions and answers with Slido, and also the webinar recorded. And also we will get from Yolanda the summary of your responses to the first exercise, and this also will be shared with you all by email very soon. Okay, so yes, and I'm also reading the questions that come in the WhatsApp, in the chat box. Actually, there is a link was provided to all those who attended the previous webinars to connect to the Rapid Response Team Knowledge Network in WhatsApp. But actually, what happened is that the group is full now. So now we are going to share, before the end of this presentation, we are going to share a new link. It will come soon. So Silvio, I think we can stop here.
Okay.
Yes, so that we can continue with. Thank you very much to all for responding to the evaluation, and thanks to Silvio for facilitating that. So now you have, at the end of this presentation, you have a series of selected resources that our subject matter experts selected for you with regards to this topic. And in terms of the next steps, you may know that we will be having another webinar on Tuesday next week, 20th of October, same time. And the webinar will be on occupational health and safety in the context of COVID-19. So we would be glad to have you joining this webinar. And an information about evaluation of participant learning. There will be a final evaluation of participant learning at the end of the 4 webinars, and the evaluation will be cross-cutting to the 4 webinars. And further to this evaluation, successful participants, meaning those who have more than 80% of correct responses, will be provided with a certificate of completion of the webinar series. And we will be sending to all very soon, also this week, a link to a poll for you to vote on webinar topics that you would like to have, if it's the case, in November. Actually, when you did all register, we got, you had a question that was about which additional topics would you like to see elaborated in a future webinar. And actually from that question, we collected a great number of responses and suggestions that you are making. And we have tried to group those suggestions in themes. So we want to present you all with these themes and ask everybody to vote for the ones you would like to see covered in the webinar. So we will be doing that by email very soon. And then here we have, you have now the proper link to be joining the Rapid Response Team Knowledge Network. And I'm going to give the floor to Katrina, who will take us through that part.
Thank you very much, Paula. And I can see, hello again, everyone. I can see some people comment that the WhatsApp is full. Yes, as Paula said, we have reached the maximum number of people from the participants who have joined from last week. But we do also have, we're starting to migrate our members to Microsoft Teams because there's a bigger group limit. And actually it's a newer platform that might take a little time to get used to, but it's better than WhatsApp or Telegram. because it's easier to collaborate, it's easier to store our documents, although it's not as rampant or as widespread as Telegram or WhatsApp yet. So please do discover what Microsoft Teams can do using bit.ly/welcome to MS Teams. And to join the RRT Knowledge Network on Microsoft Teams, please either scan the QR code or go to bit.ly/RRTKN Teams. We already do have more than 200 members also on Microsoft Teams. So I encourage everyone to please discover what Microsoft Teams can offer and to join the Rapid Response Teams Knowledge Network on Microsoft Teams. Thank you very much. Over back to you, Paula.
Thanks so much, Katrina. Thanks to all. We are now at the end of our webinar. We have been able to do that on time. And I want to thank the entire facilitation team. And of course, I want to thank all the participants who were actively engaged into this session. I think this will be all for us. If you want to open your camera or your mic to say goodbye to everybody as we are leaving, it would be nice to see each other.
Bye. Thank you so much.
Thank you.
Bye bye. Thank you very
Thank you
much.
for joining.
Goodbye.
Much.
Thank you.
Excellent.
Bye bye, everybody.
Bye bye.
Very nice to see you all. Thank you.
Thank you.
Thank you all.
Thank you.
See you next time.
Thank you.
Thank you,
Great.
Mr. Tendable.
Thank you.
By the way, I'm already accepting some of you in the.
Thank you.
Bye bye.
Thank you for
Bye.
thank you for joining
Bye bye.
Emergencies.
Thank you very
I'm
much.
already accepting many of you.
Nani.
Okay.
Okay. Bye bye.
Bye bye.
Bye
Bye
bye.
bye.
Bye. See you soon.
Okay. So I will be ending the meeting because this is what stops the recording, and so we don't have a very, very long recording at the end. Thanks to everyone, and have a great end of the day, great evening, great morning. Bye.